Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I am Urvashi. Today we will discuss about skincare problems and ways to take care of skin with our expert Dr. Amee Daxini, who is a gold medalist, MD in Dermatology from Grant Medical College, JJ Hospital, Mumbai. She has 20 years of experience in skincare and is here to share some of the tips and knowledge of skin and skincare. She was the Associate Medical Head of Kaya for South India and Middle East and is currently practicing in her clinic in Bangalore called Think Skin Clinic. Hello Dr. Amee, welcome to a podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, can you tell us why skincare is an important factor?
Hi, today I'm going to talk about personalization and customization of skincare. Sometimes we get very carried away by beauty influencers, sometimes even our family and friends, and start overusing skincare products. Let's sit back and think what we apply, is it necessary or not?
What should be the skincare routine?
As a dermatologist, I have been questioned time and again as to what exactly should be the skincare routine, especially for someone who does not have any skin concerns. If I look at the face, the most important thing that one needs to do is clean it and protect it. So in cleaning, a cleanser or a face wash is essential. We avoid using soaps because soaps make the skin drier and thereby sometimes cause excess oil or rebound oil secretion. And second comes protection. For drier skins, a protection first starts with moisturizer. But people with combination of oily skins do not need that very regularly. Again, the skin type changes with weather. So in winters, you need more moisturization than you need in summers. But the most important skincare product that should be there in everybody's routine is a sunscreen. The ultraviolet light has been intensified since when we were children or our parents were young. Therefore, the skincare needs change with the ozone layer depleting and our exposure to devices and other UV light radiations has increased. We're noticing early signs of aging, pigmentation, uneven skin tone, all because of excess exposure to ultraviolet light, which then causes inflammation, and that inflammation subsequently leads to pigmentation and early aging. Therefore, use of a sunscreen in everybody's routine is very important. But for today, remember two important steps in your routine: cleaning twice a day and not more. Use of a sunscreen every 2 to 3 hours, especially if you step out. Moisturizer bases your skin type and the weather conditions. If you have concerns like pigmentation, acne, aging, then a night cream or a serum is advised. For these treatments, it's always better to consult an expert like a dermatologist rather than picking up something which is over the counter or what you have seen online. Do consult an expert before you pick up your skincare products because that's going to help your skin and it will reduce the trial and error phase of your skincare routine.
What are the types of sunscreens and how do they work?
Sunscreens are of two varieties. One is called the physical sunscreen and the second is called the chemical sunscreen. Now these all differ by the way they act, also by what the content is. We recommend physical or mineral sunscreens for all children up to 12 years of age. Beyond that, a chemical sunscreen can be used.
Is there any difference between two sunscreens in how they act?
How do they differ, in the way they act? A physical sunscreen just refracts or throws the sunlight or UV light that falls on the face out. Whereas a chemical sunscreen absorbs the light, converts it to heat, and that heat then dissipates in the skin. So this is how the two sunscreens differ. Chemical sunscreens should be used at least 20 minutes before you step out because it takes that much time to act and you need to keep repeating it every 2 to 3 hours because its effect starts wearing off. In a physical sunscreen, you can use it immediately before you go out, but again, a repeat of the sunscreen is extremely important. Physical sunscreens also have a little white sheen, so sometimes it's not very desirable. So physical sunscreens we advise to use immediately after the moisturizer so that it spreads well.
What is the message that you would like to give to our listeners?
If you are an athlete or you're a trekker or runner or biker and out in the open for a long time, I as a dermatologist would recommend dual application. That is, first a chemical sunscreen followed on top by a physical sunscreen. It gives you the best of both worlds and prevents easy tanning as well as burning of skin.
Thank you, doctor, for being a part of Medica Talks and sharing your insights. We are hopeful that the skincare routine was informative and many of us will follow the same.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.